Okay, sorry that took longer than it usually does, but I think it's working now. So we're going to finish up the skin integumentary system, a few slides to finish up the overall integumentary system pathology, and then we'll get into skin disorders that primarily affect children or very commonly affect children. One more piece of technology to put together. Aha! Okay, we started off the last one with breaks. We'll start this one off with burns. Of course, you know, this is more general. It could affect children or not. So we're kind of finishing up the general stuff. Talk about burning the skin. We all know the concepts of the first, second, and third degree burns. They're also called partial thickness, superficial and deep partial, full thickness burns. What they're mainly talking about is it just affecting the epidermis? Does it do some or all of the dermis? And does it damage tissues underneath? So the first degree burn is just epidermis. That will heal. First degree burns are almost never a problem. Second degree burns can be. They go down and damage at least some of the dermal layer underneath. So you're getting into blood vessels, you're getting into some serious nerves. Full thickness burns, you've burned all the way through the skin down into the tissue below. Generally, skin grafting or something of that nature is going to be needed. First degree burn, this kind of sunburn we're used to, although a second degree sunburn is more than possible. We've probably all gotten burned bad enough that we blistered up. And that is generally the idea of a second degree burn. Superficial, partial thickness burn, oozing a lot of fluid out as the little bit deeper layers are burned. Another true second degree burn, here the skin is sloughing off right away. It hasn't killed the dermal layer underneath necessarily, but it has certainly gone deep enough that there's nothing holding the epidermis onto the dermis anymore. And a third degree burn, it can go all the way down to the bone, as deep as it needs to go, and it can cause contractures, it can cause serious scarring, it can cause a need for skin grafting. Here we have a deep third degree burn that has damaged muscle and tendinous layers underneath, leading to contractures and inability to straighten out the joint completely after that. After third degree burn, various hypertrophic scarring, keloid type scarring is common. And here we have a skin graft. There are a variety of kinds of skin grafts. You can take a piece of skin off your own body from somewhere else, grow it into a larger piece, and then put it on. You can put a whole bunch of little holes into it and stretch it out like gauze, and take a piece of skin that is fairly small and use it to cover a pretty big area. And those are autografts. They are autodermatoplasty is what it's called, and that's because it's coming from self. Heterodermatoplasty is coming from somebody else, it's coming from a pig, it's coming from anywhere other than your own body. You always hear that people were burned over 60% of their body or 70% of their body. The rule of nines helps you do a quick assessment as to the extent of burning. The front of the arms, 4.5, 4.5, 9. The front of the torso is 2 times So it's 18, 2 times 9. Another 4.5 here, so half of 9. 1% in the groin area, 9% on the front of each leg, 9% on the back of each leg, the back of the 2 arms together, 18 on the back. So if somebody burns both arms and their torso, you have a pretty good idea that they were burned over X, 27% of their body. Burns don't just affect the skin. Your skin is your thermoregulatory mechanism, so you have a hard time maintaining your temperature. Fevers are very possible. You suddenly become non-waterproof. Any kind of infection can get in without any problem, and you lose fluid like mad. Edema is very common. You damage the blood vessels underneath the skin, and they start leaking fluid, and it either leaks completely out of the body and you lose it, or it causes a great amount of swelling. Edema, tissue ischemia from the swelling and damage to the blood vessels. Shock is very common, multi-organ failure ultimately. People who are burned over a large percent of their body have a pretty poor prognosis. It's way better than it used to be, but it's a huge body shock. Another way of burning yourself is through frostbite. And this is not hypothermia. Hypothermia is where your overall temperature gets so low that your enzymatic activity can't support metabolism and your heart slows down and your breathing slows down. Frostbite is when the tissues actually freeze, like putting them in a freezer, and the fluid inside the cells crystallizes and swells up and ruptures the cells and kills them. So frozen tissues generally have to be cut off. If it's just the skin, you know, it'll sometimes heal back, sometimes real well, sometimes not so great. Well, she'll probably lose the end of her nose, but her eyelids will probably regenerate okay. Inflammation and immediate death are a problem. So is reperfusion injury. You don't want to heat it up too fast. You don't want to put these in hot water. You put them in kind of cool water and let them thaw, and then gradually warmer, or the reperfusion injury can do more damage. Okay, so skin. Then we have hair and nails. We have plenty of problems that can happen with them. We've seen a couple of those, a lot of fungal infections and bacterial infections. Alopecia is the term that's used for hair loss for any reason. Male pattern baldness is alopecia, and the man's hairline recedes or it falls out in the middle of the crown of his head. Female pattern baldness is usually just an overall thinning. But there are conditions that produce alopecia. A good friend of mine played volleyball at the U.S. Open with me, and he went through this, and all of his hair came out. His body hair, his eyebrows, his eyelashes, his hair. It's related to stress. It's kind of an autoimmune attack on your own hair follicles. Hair follicles are kind of vulnerable anyway. They're very fast-growing, fast turnover. That's why they respond more to chemotherapy and all your hair falls out. And sometimes when you correct the problem, it'll grow back in. His did, but it took a couple of years. Male pattern alopecia, again, across the top of the head, the bald spot. Female alopecia, generally the hair gets thinner and thinner as time goes on. These are both related to changes in androgens and estrogens, the total amounts and the balance between androgens and estrogens that go with age. Hirsutism is a term that means you have too much hair. Now, guys can have too much hair and basically have a pelt, but it usually is referring to a female that has hair where guys normally have it. Hairy face, chest, back. Again, it is androgen sensitive, so often it is a slight imbalance between androgens and estrogens. Remember, men and women both make androgens and estrogens. Men just usually have a predominance of androgens, and women who have a predominance of estrogens. So testosterone versus estrogens. It changes as your life goes on. Some people, the balance isn't perfect right to begin with, and others, it changes as they maybe go through menopause, or men get older and their androgen levels drop. Nail disorders come in a variety of flavors. Bacterial infections, growth problems, and fungal infections are the most common. A inflammation around the nail bed, under the edge and around the back of the nail. Paronchia, onic means nail, so paronchia or paronchia is the soreness around the nail and under the nail, sometimes a pus pocket under there. Onychocryptosis, the term crypt means underneath or hidden. It's an ingrown toenail in this case. Ingrown fingernails, more commonly ingrown toenails from the shoe pushing against the end of the toe and causing the nail to grow underneath the edge, nearly crippling in their painfulness. And onychomycosis, if you remember, mycosis means fungus. So this is nail fungus, most commonly toenail fungus. You pick it up from, walking around in dirt that has a lot of fungus around it, or in locker rooms or whatever. It's fairly common. It's real hard to treat. Again, you can use topical antifungals, but it's hard to get them under the nail where they really need to go. You can have the nail removed and then treat it as the new nail comes out. The trouble is, if you remove a nail too many times, when the new one comes out, it has a tendency not to reattach. It's kind of loose. And so ultimately, it's kind of a self-defeating thing. You can take systemic pills, antifungals, that are fairly hard on your system, but they're more effective in actually getting rid of the fungus. Okay, let's talk about some childhood skin diseases. As there are skin diseases, lots of skin diseases for everybody, there are lots of different ones that like to affect children in particular. The first one that you can think of course, is acne. And this isn't exactly child, but at the time of puberty, which can be anywhere from 12 to 16, and then the problem may continue beyond that, your androgen and estrogen levels go haywire, and they tend to become cyclical. They're really high at night, low in the daytime, and they cause your androgen-sensitive tissues, they cause you to grow body hair where you haven't been growing anymore before. They cause your sweat glands to change so that you produce a different kind of sweat under your arms and in your groin. More oils come out. Most people actually have acne of some degree. And what they are, the sebaceous follicles, the oil glands that are sending oil into the hair follicle to come out with the hair, are putting out so much oil that it blocks the follicle. The glands themselves may get blocked and start to swell up. The hair follicle may get blocked and start to back up. And you form first blackheads and whiteheads, which are relatively small. They're, you wish you didn't have them, but they're not that big a deal. If it becomes inflammatory, it actually gets infected in there, and you develop cysts, pus-filled cysts. Keratinization, more keratinized substances come out and help block your pores. Too much production of oil, sebum. And then the good old infection starts. We have our Probionibacterium acnes, or P. acnes, which is your own good old acne bacterium. It's slightly different than anything else. Treated topically. There are systemic therapies that are working better and better. Surgery to actually lance the cysts, and then dermabrasion and other treatments to try to get rid of the scarring afterward in somebody that's had a really hard time with it. So true cystic acne produces really deep pocket lesions, and if they rupture, they can leave a scar there. They leave a small crater. So getting rid of them before they rupture is preferable. There's a Accutane. This is on one of these slides somewhere. Accutane is what they're using now. One of the women in my last pathophysiology class works at a dermatology office, and she said that it's quite effective. It is systemically difficult, and it is teratogenic. It causes birth defects. So you can't take it if you think you might get pregnant. Atopic dermatitis it's dermatopic. A means without a topical cause dermatitis. It kind of comes up, not exactly clear where it's coming from. Something has stimulated your immune system to cause an allergic response that causes this breakout of the skin, and yet there's not an allergen specific that is causing it. Otherwise, it would be contact dermatitis. So atopic dermatitis, there's no particularly known cause. Keeping it clean and keeping anything away that could exacerbate it is a good try. Very common form of inflammation or eczema in children. And again, it looks like an allergic response because the immunoglobulin G cells, histamines, and stuff will proliferate, but you take away stuff and it doesn't always make it go away. Itching, the skin breaks, forms pockets, oozes out, and it itches so much that kids tend to scratch and get infected. So here's an atopic dermatitis. Anti-inflammatories like, hydrocortisone and stuff, and even immunosuppressants if it's serious enough, because you can't get your immune system to quiet down and quit attacking your own skin. Diaper dermatitis has its own name, diaper rash, diaper dermatitis, and this is a contact dermatitis. The diaper, the feces, the urine, the sweat, the wet causes inflammation, maceration. That means softening of the skin. It's like dishpan hands. If you put your hands in the water too long, it takes all the oils out of them, and it gets kind of soft and easy to cut and easy for bacteria to move in because it's not really waterproof anymore. So wet diapers The airtight, the new plastic diapers, in the old days, the cloth diapers were actually better for the kid in a lot of ways, except, of course, they would leak through them. And then they put plastic panties over the top of them, so then it wasn't any better than a pamper or something like that. Early introduction of cereals actually may have an effect. Even kids who will have no problem with cereals later, no gluten sensitivity or anything, sometimes are not able to digest them properly, and either their skin reacts or their feces has products in it that are more irritating or something, and they wind up with anything from slight reddening to really bad reddening to really rough skin to lesions that burst and leak. So here's a more minor, probably doesn't seem minor to this guy, but that would certainly seem more major to her. So, frequent diaper changes, keep it dry, keep it dry. Let them be naked if you can. You know, if they've just pooped and peed, don't put a diaper on them for a while, let them air dry. And some antifungals sometimes help. Topical steroids like hydrocortisone type of things that are specific for babies, but can reduce the inflammation. Malaria is essentially prickly heat. You get hot, you get sweaty, you're out playing all the time, you got a shirt on, and it doesn't wick the sweat away, and it kind of blocks the pores and causes inflammation in all the pores, and they all get red. You can have a total blocking of the pore, and then the sweat fills up a little cyst underneath and can pop, and it looks more like a second-degree sunburn. Or you can have just the reddening, another version of malaria. A serious bacterial infection can happen to babies, especially shortly after birth. And it's a staph infection, but it covers the skin. It causes a separation from the dermis, from the subdermal layer of epidermis, and it just all comes off. And it's called scalded baby syndrome. It looks like they were just dumped in boiling water and all their skin is coming off. And it's really like having an overall body second-degree burn, and it can be quite serious. Antibiotics, and keep them septic, antiseptic, so that they don't get infections with all this exposed fresh skin. Another bacterial infection is called impetigo, and this is kind of common to kids. It's a staph infection, and kids get it because they're always playing around in the yard, and they're playing in the mud, and they're playing in the dirt, and they're getting staph, and all you need is the slightest abrasion. And kids' skin is pretty delicate and tender anyway. It's a little easier for bacteria to get in, and therefore you get these infection lesions. It looks like a bad cold sore, except it can spread a lot wider than a cold sore and tends to be deeper into the skin too. Bullous or vesicular impetigo would have bumps filled with fluid. Even in the name it says it's contagious. So if one kid has it, don't have them in a wrestling match with your kid. Children get a lot of fungal infections, ringworm type infections. It's basically the same fungus, but depending on where it is, it gets a name for its location. ringworm is tinea corporis. We saw a good picture of that. The big looks like a ring. It starts in a small area and the fungus grows outward and it sort of clears in the middle, so it looks like a ringworm. If it's on the scalp, it's tinea capitis. Tinea corporis if it's the body. Again, you treat it with antifungals. And since these are topical and it's not under the nail or something, the antifungals work pretty well. Here's tinea capitis, fungus of the scalp. Remember also that tinea pedis is athlete's foot and tinea cruris is jock itch, just depending on where it is. Now, kids can get herpes cold sore infections. Kids generally don't have genital herpes, and they don't have shingles yet, although they may have the virus that will cause it later. But there are some different viruses that kids can get in their skins. Contagious, again, this is another contagious one, molluscum. They think it looks like barnacles on the bottom of a ship. And it's like small, little individual cold sore vesicles. It will clear up after a while on its own. Antivirals are not terribly effective. They're getting better, but they're not as good as antibiotics. But this will run its course. I don't know if they have discovered an adult disease from kids who had this as a kid, like they have with chickenpox. Another viral infection, a couple of different kinds of measles. German measles, the 3-day measles. These are RNA viruses, so they're not in the nucleus. They're out at the RNA affecting the translation portion of the protein synthesis. Lymph nodes swell up, runny nose, cough, and you get a rash all over you. It's a very distinctive disease with that. Measles vaccinations are available now. Most, a lot of kids are getting the combined one. These are the rubella and rubeola are both measleses and mumps. And it seems better. It used to be that it was great if your kids got over their childhood illnesses. They got through with mumps, and they got through the measles, and they got through this, and they got through with that. But because people are living longer and starting to have some repercussions by having had childhood diseases, it would be better to avoid them than just to, have a party and make sure all your kids get sick at the same time and get over it. You may be putting them at some risk later in life. So here's measles. Feels bad, looks worse. Rubeola, a little bit more dense inflammation and a little bit more dramatic symptoms. High fevers, red eyes, pretty bad cough. And our good old chickenpox. This is the one where everybody, when I was growing up, if one kid had the chickenpox, everybody said, oh, well, everybody's going to get it. We might as well all get it at once. They'd get them all together in a room and give them all chickenpox, and then they'd never get chickenpox again. It's the herpes zoster virus. The trouble is, all of those kids have that virus in their cells for the rest of their lives, and it can come back out as shingles as adults. Generally, it's not a problem for the kid who has it, although people are driven to near suicide by the shingles that may come later. And there is a vaccine for it. Chickenpox, little bubbles all over. And of course, shingles, the same virus, the same herpes zoster that caused the chickenpox in the first place. And should probably mention smallpox. Now, smallpox is a whole different level of animal. Highly lethal. Killed lots and lots of people. Lots of children got smallpox and died from it. White man came over to the United States, to the Americas, and gave it to the Indians that had no immunity to it at all, and wiped out a lot of the Native American populations with some other diseases, but smallpox was a big one. It has been considered eradicated from the earth by the smallpox vaccinations, and they stopped giving them a long time ago. I had 2 smallpox vaccinations when I was growing up in the 50s and 60s, and I still have the little scar from it. They don't give vaccines anymore, and the problem is there are no more cases of smallpox in the world in public. However, some scientists still have some of the virus, and the fear is that a terrorist group could steal it and spread it, and now we have 2 generations of people since I was born that have never been vaccinated. And you could, wipe out a third of a city with smallpox. Kids get a lot of bug bites. Scabies are mites. Mites are tiny little, nearly microscopic critters that burrow into the skin and cause itching and inflammation. It is contagious in that people who are coming in contact with each other can pass mites from one to the other. They actually tunnel about a centimeter into the skin, and they lay their eggs in your skin. Really pleasant. Usually, scabicide will kill them. Usually, there's no particular risk. Mites, scabies, and they are almost like single-celled animals. They're so small. Lice are a little bit bigger. They're not as big as a flea. I guess maybe some kinds are. You can see them. They're also very contagious. Kids used to get head lice a lot, and they would not let them go to school until they scrubbed their scalp with turpentine or something or coal oil to kill the lice. And because mites and lice they strike you similarly, and it's hard to remember that one is scabies and one is pediculosis. Losis sounds like lice to me. Pediculitis, pediculosis. So you can remember which one refers to lice. Pedicula capitis is on the head, pedicula corporis is on the body, and pediculus pubis, or Pthyrus pubis, are pubic lice, or crabs. You can see why they might call them a crab. These do not burrow into the skin. Flea bites, of course, are common to anybody that has pets around the house, especially if you have carpets and they get fleas in them. Kids play with the animals a lot, and so they get bites. Flea bites are they're pretty itchy, they're pretty intense. The kid can scratch them a whole lot. But the other problem, of course, is that fleas carry diseases. They carry bubonic plague. So it's not common anymore, but it is possible to get some diseases from flea bites. Treat your infected animals, wash with hot water, insect repellents, I suppose. Kind of big bumps. Now, the other disease you can get from being bitten by an insect is Lyme disease, deer ticks, and this produces, it's a bacterial infection actually, so that you use antibiotics to treat it. But these particular bacteria are called spirochetes. Sounds like a parakeet that flies in circles or something. But actually these tiny little critters are shaped like a spiral. If it's treated early, the trouble is there's a latent period where it has time to kind of spread before you know you have it. If you can treat yourself right away, it's not that hard to treat, although still harder than most bacterial infections. If you wait till it's bad, though, I've known people that were treated for Lyme disease for a year. Bedbugs. Looks like a tiny cockroach. They are tiny. So, if you have a bunch of them on your skin like this person does, there'd be a whole bunch of just little brown dots on your skin. And they bite, suck your blood, and then go away and enjoy themselves, reproduce or whatever, make more bed bugs. They leave a brown splotch like a freckle that lasts a while. And finally, a few blood vessel tumors that kids are born with or develop shortly after they're born. Hemangioma refers to blood vessel tumor, hemangioma. And there are a couple of kinds that have to be removed surgically. Strawberry hemangioma looks like a small berry sticking out. The cavernous hemangioma is deeper, like it's in a cavern, and so it pushes the skin out from underneath instead of sitting on the surface. So here's the strawberry hemangioma, and the cavernous hemangioma is beneath the skin and causing this big swelling in this baby's face. And the kind that don't have to be removed, unless you just don't like the way they look, are birthmarks. If it's a little enough one, you can call it a beauty mark and get away with it. If it's a little bit bigger, it looks like you have a black eye. My niece, a very pretty young lady, was born with a pretty big birthmark around her eye, and everybody always thought that she either got beaten or ran into a wall or something and was asking her. It was really embarrassing. She finally, in her early teens, went to a plastic surgeon, and it was kind of like removing a tattoo. They did several treatments to remove the darkened tissue or darkened skin and got rid of most of it. So it wasn't that noticeable afterward. Port wine stain is what she had. It's the really dark one that shows up a lot. And salmon patches are just kind of a light orangish stain on the face that often resolves by itself. So here's the port wine stain. See, this guy's not happy at all. This one knows it's going to go away, so he's pretty happy about it. The salmon patch hemangioma. And that does it for the integumentary system.